Let's see an NCLEX RN video based on assessment of hematological function. The nurse correlates which physical assessment finding to moderate anemia in a female adult patient. Heart rate 80 beats per minute, hemoglobin 16 gram per 100 ml, elevated BP, complaints of shortness of breath with exercise. So here the patient is having anemia and patient is a female. In anemia, fatigue and shortness of breath either at rest or on exertion is noticed. Heart rate will be increased to improve the oxygen delivery, and here the hemoglobin level is normal. The BP, especially the systolic BP, tends to be lower than normal in case of anemia. The nurse monitors which test result to assess blood loss in a patient: lymphocyte count, hemoglobin electrophoresis, hematocrit, CBC. So to assess blood loss, we need to check for hematocrit, which will be reduced because it measures the percentage of RBC. Lymphocyte count is in relation to infection or inflammation. Hemoglobin electrophoresis is useful for separating and measuring normal and abnormal hemoglobin. CBC just provides data on number of blood cells as well as hemoglobin, hematocrit and RBC indices. The nurse in an outpatient clinic is scanning the laboratory reports that were just faxed to the office. The patient reported an INR of 2.5 is having an evidence of appropriate therapeutic outcome for which patient? A patient who is undergoing warfarin or Coumadin therapy, a patient who just received 24 hours of subcutaneous heparin injection, a patient who is scheduled for a liver biopsy, a patient who has a diet rich in vitamin K. So INR is International Normalized Ratio. It is performed to measure the prothrombin time and to evaluate the effectiveness of oral anticoagulant therapy, that is warfarin sodium or Coumadin. Then the normal for a patient receiving warfarin therapy, the therapeutic INR is 2 to 3. So here the question is asking the patient is having 2.5, that means therapeutic outcome of warfarin therapy. The nurse observes petechiae and purpura on a newly admitted patient and correlates these findings to which diagnostic result? Hematocrit 27%, platelet 7000 per millimeter cube, WBC 5000 per millimeter cube, prothrombin time 20 seconds. So here the patient is having petechiae and purpura, that means there is an increased risk for bleeding. Here, if you see the platelet count, it is much lower. If the platelet is lower, there is a chance for bleeding. Normal platelet count is 1 lakh to 3 lakh. The nurse recognizes which patient is at greatest risk of a low reticulocyte count. A patient receiving iron supplements for iron deficiency anemia, a patient who has an untreated macrocytic anemia caused by vitamin B12 deficiency, a patient who recently moved to a high altitude, a patient who had acute blood loss last week because of a heavy menstrual cycle. So the patient at greatest risk for a low reticulocyte count is a patient who has an untreated macrocytic anemia caused by vitamin B12 deficiency. A low reticulocyte count indicates hypoproliferative bone marrow or hypoplastic anemia or ineffective erythropoiesis, that is pernicious anemia. So pernicious anemia occurs when the body cannot properly absorb vitamin B12 from the gastrointestinal tract because B12 is necessary for the proper development of RBCs. The nurse recognizes which statement is correct about blood cell formation. It occurs mostly in the marrow found in flat bones such as sternum, ribs and pelvis. It occurs mostly in the marrow found in the shaft of long bones. It occurs in the marrow once it enters the circulatory system. It occurs after birth until late adolescence. So regarding the formation of blood cells, actually it is formed in the marrow found in the flat bones such as lower skull, vertebrae, shoulder, pelvic girdles, ribs and sternum. What is the role of erythropoietin in the regulation of RBC? To make hemoglobin capable of transporting oxygen, to pick up carbon dioxide from the tissues and deliver it to the lungs, to decrease RBC production, to stimulate RBC production. The role of erythropoietin is to stimulate RBC production. What is the probable initial assessment finding for a patient with a low HB count? Increased and bounding peripheral pulses, hypertension, pallor and fatigue, moist mucous membrane. Pallor, cyanosis and fatigue are indicating that there is a low hemoglobin count. If there is increased and bounding peripheral pulse, that shows there is a fluid overload. Hypertension, it is not related with hemoglobin. Moist mucous membrane is a normal finding for a person. The nurse recognizes that a deficiency in a clotting factor may cause which finding? Select all that apply. Easy bruising and cutaneous hematoma formation with minor trauma, bleeding from the gums and prolonged bleeding following minor injuries or cuts, enhanced platelet aggregation and increased clumping of RBCs, fibrin molecules from fibrin threads to increase wound healing, yellowish skin color. So deficiency in clotting factor will cause easy bruising and cutaneous hematoma formation with minor trauma as well as bleeding from the gums and prolonged bleeding following minor injuries or cuts. When completing a history and physical examination on a patient with a hematological disorder, which action is appropriate? Deeply palpate the spleen to determine the extent of splenomegaly. Perform a respiratory assessment after moderate exercise for accurate measurement of depth and rhythm. Inspect oral mucous membrane and the tongue for lesions, swelling and pain. Suggest a bone marrow biopsy if the patient reports decreased energy level. So when we are doing the history and physical examination of a patient with hematological disorder, we need to inspect the oral mucous membrane and tongue to see for any paleness or any bleeding gums. Deeply palpating the spleen should not be done if splenomegaly is there. We should go for a light palpation, otherwise there is a chance of rupture of the spleen. And also the second statement is wrong. After exercises, we won't be going for a respiratory assessment. After rest only we will be assessing the respiratory rate. And also bone marrow biopsy is not reported or required for decreased energy levels. The nurse is asked to obtain a differential after the results of CBC reveal an elevated WBC count. What statement is true about a differential? Determines the percentage of platelet in the circulatory bed. Determines the proportion of each type of WBC in a blood sample. If the infection is bacterial, then the neutrophil count will be decreased. If the basophils are elevated, then the patient has a viral infection. Here, differential means it determines the proportion of each type of WBC in a blood sample. If the infection is bacterial, the neutrophil count will be increased and the basophil count will be decreased with viral infection, anemias, alcoholism and malnutrition. The nurse is assigned to a patient with thrombocytopenia. What is the priority goal of the nursing care? Prevention of infection, prevention of injury, prevention of dehydration, prevention of nutritional deficit. Thrombocytopenia means low platelet count, so chance of bleeding, so should prevent injury. Age-related changes that affect the hematological system include which findings? Iron binding decreases, number of stem cells in the marrow increases, lymphocyte function especially cellular immunity decreases, platelet adhesiveness decreases, hematocrit decreases. Age-related changes include decrease in lymphocytes, reticulocytes, serum iron and iron binding. So here iron binding decreases, lymphocyte function especially cellular immunity decreases. Hematocrit is a 25-year-old female who presents to the hematology clinic with complaints of generalized fatigue and increased shortness of breath. Over the last 2 weeks, she has had taken an afternoon nap because of tiredness. Physical examination reveals heart rate 118 beats per minute, BP 90/72 mmHg, respiratory rate 26 breaths per minute. Her skin and nail buds are pale and her tongue is red and swollen. She is scheduled to have blood sample obtained for CBC with differential. The nurse practitioner also completes a nutritional assessment to determine any possible deficits. Laboratory results include RBC count 3 million per millimeter cube, hematocrit 31%, hemoglobin 9 gram per deciliter, and a decrease in serum ferritin levels. The laboratory results of RBCs, hematocrit, and hemoglobin show a decrease in all the three values. Low hematocrit and hemoglobin and low ferritin level along with the complaints of generalized fatigue and increased shortness of breath and her pale skin and nail buds along with the red swollen tongue suggest iron deficiency anemia. The decrease in serum ferritin level further supports the differentiation of this anemia. She is prescribed iron supplements and referred to a hematologist for further evaluation. The nurse correlate which clinical manifestation to diagnosis of iron deficiency anemia? Decreased temperature, decreased heart rate, increased BP, increased heart rate, increased respiratory rate. So, iron is the key to RBC's ability to carry oxygen. So, it will result in increased heart rate and increased respiratory rate. Which diagnostic result confirms diagnosis of an iron deficiency anemia? Decreased transferrin saturation, decreased mean corpuscular volume, increased total iron binding capacity, increased ferritin levels. Here you need to know what is total iron binding capacity. Total iron binding capacity or TIBC measures the amount of iron that appear in plasma if all transferrin is saturated with iron. This TIBC is used with the serum iron to calculate transferrin saturation. In iron deficiency, serum iron levels decreases and this total iron binding capacity increases, decreasing the transferrin saturation. So here the confirmatory diagnosis of iron deficiency anemia is increased total iron binding capacity. The nurse assesses for which clinical manifestation as a compensatory mechanism for iron deficiency anemia? Increased respiratory rate, increased BP, decreased temperature, decreased pulse rate. When iron deficiency anemia is there, as a compensatory mechanism, increased respiratory rate and increased heart rate will happen. During an assessment of mouth, which finding did the nurse correlate with iron deficiency anemia? Red beefy gums, loss of teeth, red swollen tender gums or a tongue or xerostomia. For iron deficiency anemia, there will be a red swollen tender tongue. After it is scheduled to have a serum iron level in 1 month, the nurse includes which instruction about this test? You will need to fast for 12 hours before the test. The sample needs to be drawn in the morning. Continue to take your iron supplements. This test will require 3 different samples taken at hourly intervals. So serum iron levels are measured directly and samples are drawn in the morning due to diurnal variation in serum iron with lower evening values. So sample needs to be drawn in the morning. There is no need of fasting for taking the serum iron, but the patient should stop taking iron supplements just before the day or at least 24 hours before conducting the test, and only one sample is required for doing the test. Hope you understood this video. Thank you.